Part 3. Getting back on your feet.
Well, here you are, back in your own place. And while many things will seem comfortable and familiar, you might encounter some unexpected things after having a major operation. Here's how to handle some normal consequences of joint replacement surgery.
Swelling.
Some swelling for a few weeks after surgery is normal. Keep your leg elevated and apply a cold pack to your surgical area. If the swelling is severe or increases even after elevation, notify your physician.
Dizziness.
You may feel weak and dizzy when you stand up due to anemia or low blood. Eat foods rich in iron and take supplements prescribed by your doctors. Remember, get up slowly.
Sleep disturbances.
Sleep can often be disturbed for days after surgery, but I promise it'll normalize over time. Medication, being in a hospital setting, pain, and anxiety are the usual causes of sleep disturbance.
Try to maintain a regular schedule of activity, rest, and sleep. Take your medication as prescribed to control pain. Avoid caffeinated drinks after noon. Try to sleep in a cool, quiet, dark room. Drink a hot cup of milk at bedtime. If you have trouble falling asleep, take 15 deep, slow breaths. If you are still unable to fall asleep, don't worry. Get up and do a quiet activity, and go back to bed when you feel sleepy.
Sleep medication may temporarily help to reestablish sleep patterns. However, they can have dangerous side effects, especially if taken with pain medication. Sleeping pills can be addictive and lose their effectiveness over time. They should only be used if approved by your physician.
Constipation.
Constipation, everybody's favorite, is a very common and uncomfortable side effect of taking some pain medication and being less active. But you can take a preventative approach by following these steps.
Drink plenty of fluids. Maintain a high-fiber diet by eating prunes, bran cereal, or taking a fiber supplement. Recommended laxatives include lactulose, glycinid, Senocot tablets, or Senna tea. These should be used short-term only.
If you experience constipation with nausea and vomiting, consult your physician immediately.
Wound care.
If you come home from the hospital with a wound that is still draining, you will be given specific instructions at the hospital on how to take care of it. But for a dry wound, let's look at caring for that.
Once your incision is dry, leave it exposed to air. Steri strips do not have to be removed and will fall off on their own. Staples will be removed after 12 to 14 days. You can arrange with your doctor, nurse, or physiotherapist to have this done. Check your incision for redness, swelling, or increased tenderness, because these may be signs of infection.
Notify your family doctor and surgeon immediately if you have 1. Increased redness, bruising, drainage, or swelling around the incision. 2. A foul odor or yellow-green drainage at the incision or drain site. 3. Pain, redness, or tenderness to the touch on the thigh or calf. Or 4. A persistent increase in your temperature above 38 degrees Celsius or 101 degrees Fahrenheit.
By now, the joint that has caused you so much grief has been replaced by an artificial one, and believe it or not, it's already starting to work for you. It's time to get back on your feet. But first, let's talk about how to move safely.
Movement precautions.
If you have had a hip replacement, one thing you want to avoid post-surgery is a possible dislocation of your new joint. And there are certain movements that put pressure on your healing muscles and could cause your hip to dislocate.
These movements include bending forward or raising your knee, twisting, sitting on surfaces lower than your knee, crossing your legs, and rotating your legs. For knee replacements, squatting and kneeling place excess pressure on the knee joint and are not advised.
Getting around safely.
Using a walking aid will help with stability and pain control, and depending on the type of surgery you've had, your surgeon may advise you to place only partial weight on your joint. Which walking aid you use will change as you recover. First there's a walker, followed by crutches, and then a cane.
Using a walker. A walker is used in the early stages of your recovery. You will be shown these steps in the hospital, but here is a demonstration on how to use one. You or your rehab therapist will adjust the walker to your height. Walker handles should come to the height of your wrist with your arms by your side. Move the walker forward an arm's length with your back straight. Take a small step with your bad leg. Follow through to the midpoint of the walker with your good leg. Your rehab therapist will help you return to a smoother walking pattern over time. Using crutches. Walking with crutches is similar to using a walker. Adjust the crutches to your height. Your crutch height should be 4 finger widths below your armpit. Pick them up and move them forward an arm's length while keeping your back straight. Move your bad leg forward first. Then, using the crutches to support your weight, bring your good leg forward. Using a cane. Canes don't provide as much support as crutches or a walker, and shouldn't be used if your doctor wants you to put limited weight on your new joint. The top of your cane should come to the height of your wrist with your arms by your side. Hold the cane in the hand opposite your bad leg, so if your right leg was operated on, hold the cane in your left hand, and vice versa. Move your cane and your bad leg together. Think of them as a team. Then move your good leg to join your other leg.
2 canes are sometimes recommended to improve your balance. Consult with your rehab therapist for specific instruction.
Stairs.
They may seem daunting, but stairs can be maneuvered safely even with a new joint, if done properly. As you get ready to tackle them, try repeating 2 things. When going up, remember, good leg goes up, and when coming down, remember, bad leg goes down. Good up, bad down.
When going upstairs, hold the railing and place your crutch or cane close to the first step. Put your good leg on the first step and straighten it. Then lift your cane or crutch and your bad leg to the step. Remember, good leg goes up. When going downstairs, stand with the toes of both feet close to the edge. Lower your crutches or cane and your bad leg onto the step below. While doing this, bend the knee of your good leg as much as possible, remembering to put only as much weight as allowed on your bad leg. Remember, bad leg goes down.
Always wear supportive, well-fitting footwear or non-slip socks.
If you're going to be traveling up and downstairs with 2 crutches rather than just 1, the instructions are a little different.
To go up the stairs, hold both crutches close to the edge. Push on your hand grips and straighten your elbows. Put your good leg up to the first step and straighten it. Now lift both crutches and your bad leg to the same step. To go downstairs, hold both crutches close to the edge. Lower your crutches and your bad leg to the step below, taking only as much weight as allowed. While doing this, bend your good knee as much as possible to help with balance. Lean on your hand grips and put your good leg on the same step.
Now on to a few more things your new joint is ready to do.
Sitting and standing. To sit down, make sure the height of the chair is no lower than your knee. Back up until you feel the chair against the back of your legs. Slide your bad leg forward. Lean forward slightly and reach back for the armrests. Lower yourself slowly and slide your bad leg forward. This technique also applies to sitting on a toilet. To stand up, move yourself to the front of the chair and keep your bad leg extended in front of you. Keep your bad leg in front and push yourself off using your armrests. Pause for a moment, get your balance so you can feel steady before you start walking. This technique also applies to standing up from a toilet.
If you have had a hip replacement, do not bend your hip more than 90 degrees, whether sitting down or standing up. If your chair or car seat is lower than your knee, use a firm cushion that does not compress when you sit on it to raise the height. These can be purchased from a foam shop or medical supply store.
Getting in and out of bed. To get into bed, just like you're preparing to sit in a chair, back up until you feel the bed on the back of your legs. Slide your bad leg forward and reach back for the mattress. Slowly lower yourself. Some patients find it helpful to use a leg sling to lift or reposition their bad leg. Using your arms, slide yourself as far back onto the bed as possible. Pivot while lifting your legs onto the bed. You will need to sleep with a pillow between your knees for the first 3 months after surgery. To get out of bed, lie on your back and prop yourself to a sitting position using your arms to support yourself. Pivot and swing your legs over the edge until you are sitting squarely on the edge of the bed. Stand up as described in the sitting and standing section. Getting in and out of the tub or shower. You will not be able to sit in a bathtub for 3 months. However, you can use a bath bench or a seat to help you bathe safely. Back up to the edge of the tub. With one arm, reach for the seat, and with the other arm, hold onto a grab bar or other secure surface. Sit down slowly, sliding your bad leg forward and moving onto the seat. Pivot on your bottom while lifting your legs over the edge and into the tub. To transfer out of the tub, pivot your body on the seat while lifting your legs over the side. Remember to be sitting squarely before you try to stand. If you have a walk-in shower, place a secure, high shower chair or stool in your shower stall. Use a handheld shower attachment. Dry off as much as you can before exiting the shower. Use a non-slip bath mat inside and outside the stall to prevent slipping on the wet surface. Use a regular walker to get in and out of the shower.
After a while, you'll probably be eager to leave your house and go pretty much anywhere you want. Remember, there's usually a waiting period before you can drive after surgery, so check with your surgeon about when it's safe for you. But here is how to get rolling as a passenger.
Getting in and out of a car. Depending on the height of your vehicle, you may need a footstool to get in and out. Use the front passenger seat of your vehicle. Have the seat pushed back and reclined before getting in. You may need to raise the seat height using a firm cushion. Back up to the car with your walker until you feel the car seat against your legs. Find some steady handholds for yourself in order to support your weight. Lower yourself slowly to the seat, remembering not to bend your hip more than 90 degrees if you have had a hip replacement. Pivot your body on the seat while lifting your legs into the car. To exit, pivot and lift your legs out of the car until you are sitting squarely. Use steady handholds to support yourself while you stand up. Avoiding falls.
Whether you're walking upstairs or just around the house, remember that you might not be as steady on your feet as you once were. Medication might affect you. You might not feel as strong or have the same sense of balance. All reasons to take special precautions to avoid a fall.
Avoid wearing long robes or nightgowns that you could trip over. Do not lean against unstable furniture. Wear non-skid supportive footwear when walking. Use handrails where available. Wear your eyeglasses if needed. Be sure that the back of both legs are touching the seat before you sit down. Always get up slowly after sitting or lying down, and take time to get your balance before taking a step. Dressing yourself.
Sometimes patients can have a tough time dressing themselves because of stiff or painful joints, poor balance, or just overall weakness. So here are some techniques that should make it easier for you.
Try wearing loose-fitting clothing. Sit in a supportive chair with armrests, a firm surface, and a cushion to make sure you're at a good height. Ensure that you maintain good posture and movement precautions throughout. To put socks on, put your sock over your sock aid, lower it to the floor while holding the rope handles, insert your foot, and slowly pull towards your body. To take socks off, insert the end of the long-handled shoe horn into the back of the sock and remove. You can also use a reacher or a grabber if your sock is not too tight. To put on shorts or pants, begin with your bad leg. From a seated position, use a reacher to bring the pant leg over your foot and up to the level of your knee. Repeat for your good leg and then reach down and pull the pants up all the way. To take off shorts or pants, begin with your good leg. Pull your pants down to your knees and using a reacher if necessary, slide the pants off your good leg and then your bad leg. To put on or take off shoes, from a seated or standing position, use a reacher to grab the shoe and provide resistance for sliding your foot in or out. A long-handled shoe horn is helpful to ease your heel into the shoe. Replace your shoelaces with elastic ones so that you can insert your foot without untying the laces.
And finally, after you've mastered dressing, sitting, and moving around the house safely, you'll be ready to do even more.
Home exercise program. Continue doing the home exercise program as prescribed by your healthcare team until you begin therapy in a clinic, facility, or with a home care therapist. Gradually increase your walking distances the first 6 weeks after surgery. Notify your therapist if any exercise increases your joint pain or stiffness. Sexual activity.
Speaking of doing more, you may resume sexual activity when you're comfortable, but the term safe sex takes on a whole new meaning after joint replacement surgery. It's important to avoid positions that place pressure on your new joint that could lead to dislocation or cause pain.
Recommended positions include lying with a pillow between the knees or lying on your back with your bad leg straight or slightly bent.
Well, I hope this has been a valuable and informative video for you. In its 3 chapters, we've covered a number of things that you can do before and after surgery to make the whole experience easier, safer, and more comfortable for you. But if you remember only one thing, I hope it is this, that you are a crucial member of this team and you play a key role in how successful your recovery is. So ask questions, work with your healthcare team, and do what you can to take care of yourself. What you've learned about exercise and nutrition can be a permanent part of your life. So good luck with your surgery and continued good health.